Hi. So this is the third video in our little series on Carl Rogers. And I ended the last video explaining a little bit about the necessary conditions for parenting and therapy according to Rogers. And Rogers said that we need these three conditions: empathy, congruence, and unconditional positive regard. So I want to give you an example now. Let's say somebody comes to see me for therapy. He's seeing me, say, for depression. And he's been seeing me for a couple sessions. And then he shares with me that he's been molesting his 7-year-old niece. So think about that for a second. Let's look at Rogers' necessary conditions for parenting and therapy. First, I'm not going to go in order here because the order doesn't matter. It's not that one is more important than the other. So let's talk about unconditional positive regard. I need to have no judgment. I need to not judge this person for what they are doing. That's a challenge. Therapists are people. And if you think that I don't have any judgment about this, you're very wrong. The first thing that comes up is judgment, and I want to say you're a horrible person, and and then I need to have empathy. So I need to be able to put myself in this person's shoes. Now, this is also a tough one. I'm going to have a hard time trying to empathize with what they've done, put myself in their shoes. I can't imagine doing something like that. That's the truth. I can't imagine it. That's really stretching it for me. And another problem here is congruence. I have to be honest with this person. So how do you manage all this? How do you manage, I feel judgmental, I can't empathize, and I need to be honest with them? I know some of you were thinking, just throw them out and I don't know, whatever. But we're coming here from a place that Rogers is teaching us, right? So we're just talking about Rogers right now. So I'm stuck. I'm in a really bad position. And in order to be honest, I can't tell the person, those horrible things. And the other thing, how many people want to really see a therapist who sits there and just nods their head and says, oh, tell me more about that? That's not honest. I can't do that and assume that I'm helping a person. And you know what? When somebody shares something that big with you, if you pretend that you weren't just knocked off your seat, then they know that you're not really present. Somebody shares something like that, you should have a reaction, or else you're not human. And who wants a therapist who's not human, right? So let me tell you how I might go about this, how I have gone about it in the past as a therapist. Probably the first thing I would do is say to the person, give me a second. You know that what you just said is pretty big, and I need a second to gather my thoughts and feelings. I mean, why not? It's big. I should take a second, right? It's respectful in a way. And we need to do that sometimes. We need to stop and compose and get in touch with where we're at. In terms of judgment, the only way that I am going to be able to not have judgment is if I can empathize. Those two go together. If I can empathize, I can reduce my judgment, right? Now, I can't empathize exactly with what he's done, but I can empathize with having done things that go against my own values, that go against my own morality. I'm not perfect, right? I've made mistakes. I've regretted them. I've been ashamed. I can go to all that, and I can think about how hard it is for him to tell me about this and to live with himself, right? And when I think in those terms, my judgment is better. It goes down some. And it helps me to be honest. So I might say something like this. I might say something like, wow, you know that what you just said really impacted me. This is big, it's serious. Um, I imagine that you told me this because you don't want to do this anymore. Otherwise, you would not have shared this with me. And that I can get behind. You know, I can get behind him not wanting to do this anymore, wanting to stop, wanting help. And I'm being honest, right? And that piece is non-judgmental. Do I still have judgment about the molestation? Yeah, I'm human. I'm going to have to struggle with that. I would probably take that to another therapist or a clinical supervisor and talk with them about what I do with those feelings, but I wouldn't unload them on the client. I don't think that would be useful. Rogers wouldn't think that that would be useful. Chastising and punishing people, according to him, remember, we're talking about Rogers here, is not useful in any way. So that's a little example about how I might get through that. Now, I'm not talking about ethics and the law here. Of course, I would have to call the police and, all that. We're just talking about therapy in Rogers' terms, and that's an example that I have for you. And this is why therapists get paid. This is hard work. In situations like this, I can tell you that I'm drenched in sweat, and I'm working hard to try to not be judgmental, to do what is best for this person, and to be honest with myself and them. So, okay, that was our last little video on Carl Rogers. Thanks.